When you come in this kind of surgery, even though the pressure is very high, you're intervening on an animal which anyway would not go much further if you're not doing something. So at the same time, even though the pressure is high, the reward is actually also very quick, and there is not much room for hesitation. Pippin from before because he had a very complex condition called rheumatoid arthritis, and we already actually fused some joints because they were very painful. Now recently Pippin got worse because another condition which is called a cranial cruciate ligament rupture. So in Pippin's case the condition is particularly complex because there is at first more strain and more stress on the cruciate ligament, on the one that usually breaks. So with the usual technique of repair, these are tending to break because simply there is naturally too much stress on them. So today Pippin had a TPLO surgery, which is a surgery whereby we modify the whole shape of the bone, and by modifying the shape of this bone we're actually getting to a sort of a neutral point whereby the ligament which is broken will actually not be loaded anymore, and so it's a sort of an indirect treatment of a broken ligament. The normal shape of a bone would mean that we have what we call a tibial plateau or tibial plateau angle, and in most dogs it would be about 24 degrees. This is the slope of the tibial plateau, and it's actually equal to 40 degrees, so it's extremely steep. So the problem we had initially was that the ligament that was coming from here to here was actually broken, and the actual surgery intended to get this slope to almost flat so that this bone wouldn't actually slip down this steep slope anymore. It's also very challenging because the implants are very small, and the risk for cutting the bone in the wrong spot is actually higher because it's obviously smaller, and so the whole procedure needs to be done much more accurately even than for a standard procedure like a TPLO. We have achieved a much flatter tibial plateau compared to this one initially. I mean, bear in mind this is the same bone compared to each other, but this slope is now within a better range for keeping the joint stable. Overall, we achieved a very satisfactory result in his case, and I'm quite confident that he will heal without any complication and would recover usually within about 6 to 10 weeks. It's always very rewarding to see that you've operated on the dog and the people are coming even several years after, and the dog has got something else, just want your opinion for something else, but then you have the reward that they will tell you, well, the surgery you've done was actually working very well. And you not only know that just because you have seen the very short term, like healing process of the bone, for example, but you know that because the animals have actually gone back to performance, and because they've actually gone back to a fantastic quality of life, and that is probably the biggest reward you get of all, because you see that your work has not only been appreciated but also that your work's been truly effective and that you've truly improved that dog's quality of life. And a lot of people sometimes are coming back and say to us, well, you've given us our dog back. And I think that's probably the biggest reward you can actually get.